Do you struggle with pain and discomfort in underneath your shoulder blades, either on the left or the right hand side? Pain and discomfort in this area is often caused by issues with your third, fourth, or fifth ribs. And yes, ribs can become problematic like any other joint in your body. The pain and discomfort in this area, you might notice it when you're sitting at your desk, but you're more likely to notice it on the weekends. You often can notice it when you're sleeping, you might notice it when you're exercising. Pain and discomfort that occurs outside of the office in this area can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do we do most of those? At work, of course. It's really important to think about what you do every single workday and how that affects your body. You need to consider the ergonomics, the posture, and your behaviours, that what you do every single day and how they can predispose you to vulnerabilities within your body. So let's have a bit more of a chat about your third, fourth and fifth ribs and give you a bit of information about how they're designed to work and where you run into trouble as an office worker. Let's talk about the anatomy of your upper middle ribs. Now, when I mention your upper middle ribs, the ribs that I'm specifically talking about are your third, your fourth, and your fifth ribs. Now, these ribs are really problematic for office workers in terms of musculoskeletal complaints, and problems with these ribs are one of the more common complaints that we as osteopaths see. What you've got to understand about your third, fourth and fifth ribs is they're really vulnerable to injury in terms of office-related behaviours because they're a direct reflection on what you do with your arms. What you've got to understand is that your third, fourth and fifth ribs sit underneath your shoulder blades or your scapulars. You know the flat bones on your back? Those are called your scapulars. And what happens is those three ribs literally sit underneath these bones. When you sit at your desk and you position yourself well and you sit with your chest up, your elbows are by your side and you're not reaching or winging for the keyboard and mouse, there's no effort or tone or energy required through your shoulders. And this is awesome. This is where you're supposed to be all day. However, what you have to understand and how this is problematic for those ribs is when you sit at your desk and if you wing your elbow or you reach with your hand, what you're doing is you're starting to pull the shoulder anteriorly or forward. Why this is problematic is the further your arm goes forward, the more your scapula or your shoulder blade on your back has to follow that movement to support the shoulder joint. And how this becomes problematic for office workers is as the scapula starts to shift across and forward on your rib cage, what it does is it drags and it hinges off those third, fourth and fifth ribs. When you're an office worker and you have pain behind your shoulder blades, this is almost always because of these ribs being problematic. And it's almost always because you're either chicken winging your elbow or you're reaching your arm and you're pulling that scapula off the rib cage. What you've got to understand about ribs is ribs are not really designed to have any other job other than to help you breathe. So they should just simply go up and down and up and down. What ribs hate more than anything else in the world is when we start to introduce a translatory shift in the joint mechanics. When you talk about rib complaints, what you've got to understand is your rib doesn't have a very strong attachment to your spine. What happens is you've got your two ribs on either the left and the right, and then they attach to your spine at the back with this sort of attachment. Most joints, like your knee joint, for example, has this really strong buttress finish and it's a really stable position for you to be in. However, with the ribs attachment to the spine at the back, it's almost like it sits just off to the side of the cylinder. How this is problematic is it's actually really unstable positioning and it's not a great joint in that it's vulnerable to slipping forward or it's been vulnerable to being pulled out. So when we talk about those upper middle rib complaints, what happens is as the scapula pulls the shoulder forward, what happens is because of the muscular attachment between the scapula and the rib cage, it then indirectly pulls those ribs around with it. And what you end up doing is you end up irritating that rib joint because you're pulling it off the spine. So if you are an office worker and you struggle with that stabbing discomfort underneath your shoulder blade, either on the left or the right, what I would implore you to do is to review your sitting posture and review what your arms are doing over the course of the workday. It's really important that when we sit at our desk that our elbows never leave our side. We should never be reaching for anything, and we should never be winging for anything. So let's have a bit more of a chat about some ergonomic, some postural, and some behavioural things that office workers do that can contribute to this upper middle rib complaint. The single biggest cause of upper middle rib complaints is when the mouse is positioned too far away from you. It's really important that that mouse stays right close to the front edge of the desk. As the mouse creeps away from you, it will hinge off those ribs. So it's really important that the mouse stays nice and close to you so that you don't end up reaching for it over the course of the day. In a similar vein, the keyboard positioning is really important in terms of upper middle rib complaints. This reaching position, as we've discussed, is terrible for your upper middle ribs. So please ensure that your keyboard is positioned nice and close into the front edge of your desk so that your elbows never leave your side. An ergonomic consideration in terms of your upper middle rib complaints is when your office chair is positioned too low. Good office chair positioning is when your elbow just clears the height of the desk. So this is the ideal height that your chair should be in. If your office chair sits low and that your elbow sits below the height of the desk, what you have to do is you either need to chicken wing your elbows or you need to hitch your shoulder to get over that height difference. Where this plays into middle upper rib complaints is when you have to chicken wing your elbows. As we discussed, as soon as this elbow leaves your side, it hinges on those ribs. So make sure that your chair is positioned so that your elbow clears the height of the desk. Another ergonomic consideration in terms of upper middle rib complaints is when we use the trackpad on a laptop. Trackpads get you into lots of trouble because to use a trackpad on a laptop, you have to essentially chicken wing your elbow to get that arm into the right position to use both the trackpad and the keys. Generally speaking, we don't love your laptop use for any excessive periods of time. And what we recommend is if you do use a laptop, use it briefly and to use a secondary mouse. A posture that should be considered in terms of upper middle rib complaints is when we lean on our elbow in this capacity. Arms are not load-bearing joints. They're not designed to take any sort of load, particularly your body weight, for any extended periods of time. The problem with this posture is what you're doing is you're leaning on your elbow and you're dragging that scapula and that shoulder off your rib cage. As we've discussed before, the ribs don't have a very strong articulation to the spine, so the drag of this scapula on those ribs can cause upper middle rib complaints. It's really important that we remember that our arms are not load-bearing joints, so bring your body weight back into your chair and have your whole body weight against the backrest and let your arms just hang passively by your side. We've already talked about how winging your elbow is really problematic for those upper middle ribs in terms of ergonomic awareness. However, sometimes we can have our chair at the right height. Sometimes we can have our keyboard and our mouse in the right position. However, what we can adopt is this behavioural predisposition to chicken wing our elbows when we use the keyboard or the mouse. As soon as my elbow leaves my side, there's a huge amount of tonal change that happens underneath my scapulas. You can see how hard the muscles through this area have to work to maintain this position. It's really important when we're thinking about our behaviours that we consider where our elbows are. What should happen is when you use the keyboard and mouse, you should have no tension or tone going through your shoulders, and your arms should hang passively by your side. In a similar vein to winging your elbow, reaching for the keyboard and the mouse is problematic for your upper middle ribs. As we discussed, the further our arm comes away from the body, the more strain that goes through our shoulder blade, which hinges off those upper middle ribs. What can happen at the start of the day, the mouse might be in a really good position or the keyboard might be in a great spot. However, over the course of the day, what can happen is that one of the two of them can slowly creep away from us. And then before you know it, at 3 o'clock in the afternoon, your arm is halfway across your desk maintaining this mouse position. Something that you can do to prevent the mouse from creeping away from you over the course of the day is to either use a mouse pad or to simply fence the mouse in. And this is something where we give the mouse an A5 parameter to work with. We put a really heavy folder at the top margin of the mouse and we put a really heavy folder on the lateral margin of the mouse. That way, over the course of the day, if the mouse does start to creep away from you, you will physically hit that and it will bring your awareness back to making sure that mouse is in a good position. It's really important from a behavioural perspective that we're conscious about where our arms and hands end up over the course of the day. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.